Om Swastiastu, we are from B7. In this occasion, we will present our student project entitled Influenza Vaccine for Adults. Here are our group's members. This is the outline of our presentation, including introduction, literature review, and the conclusion. Okay, firstly, let me introduce myself. I am Muhammad Islamullah Hudayana with 3 last digit student registration number 093. The background of our writing are: first, the influenza is communicable disease of various age group through the respiratory droplet that affect upper and lower respiratory tract caused by influenza virus. Second, vaccination has been proven effective in maintaining health and preventing the spread of influenza virus and its related complication. The third, CDC recommended giving vaccine annually for health persons who more than 6 months. It's most effective in children over 2 years and healthy adults. And the last, it is important to discuss further of the influenza vaccine for adults so that health workers are able to understand the role of vaccination in preventing the spread of influenza among the adult population. The problem we have formulated include: what is the influenza disease? What is the history of the influenza vaccine? What is the immunological mechanism of influenza vaccine? What is the indication and contraindication of influenza vaccine for adults? What is the administration of influenza vaccine? How effective the influenza vaccine for adults? And the last is: what is the complication of influenza vaccine for adults? The purpose of our project are: explain the influenza disease, explain the history of influenza disease, explain the immunological mechanism of the influenza vaccine, explain indication and contraindication of influenza vaccine for adults, explain the administration of influenza vaccine, describe the effectiveness of influenza vaccine for adults, and the last is explain the complication of influenza vaccine for adults. Besides, this is our final assignment. We expect that this article helping us to increase the knowledge in influenza vaccine for adults as prevention the disease and its related complication.
I will continue the presentations, but before that, my name is Idayu Parthini Surya with last 3-digit student number 230. Now, I will explain about the overview of influenza disease. Influenza is an infection caused by the influenza virus that infects the respiratory tract. This virus can spread through aerosols and droplets from direct contact when sneezing, coughing, shaking hands, and touching something that contaminated with the virus. Transmissions of this virus occurs more often in cold weather, especially in crowded areas and public places. Symptoms that often occur in influenza cases are fever, cough, sore throat, runny nose, malaise, muscle and joint pain. In general, influenza can occur within 2 weeks and will reoccur if the person is in bad condition. So even though the initial symptoms of this virus are mild, influenza can cause severe illness, hospitalizations, and death. Thank you.
Thank you for the opportunity. First of all, let me introduce myself. My name is Nipita Cynthia Harum Pracita with 3 last digit of student ID is 018. So now I will present about the history of influenza vaccine. The initial development of influenza vaccine was initiated by the influenza outbreak in Puerto Rico in 1934. At that time, the vaccine was made by isolating the influenza A virus. Furthermore, in 1942, a vaccine was made with isolation against the influenza B virus. Then, in 1977, vaccine for influenza types A and B were introduced. The vaccine contained 2 strains representing type A and 1 of 2 strains of type B influenza virus. Then in 2013 until 2014, United States introduced a new vaccine containing the same strain A and 2 strains of influenza B virus. Then in 2017 until 2018, the influenza season occurred again. At that time, the outbreak is really severe with a lot of confirmatory cases and deaths. Until now, the development of latest influenza vaccine still doing. There are 2 types of vaccine that is inactivated and live attenuated that protect against influenza type A or B. Okay, that's all from me. It will continue by my friend. Thank you.
Hello, my name is Adam Sulfikar with my last 3-digit number is 166. So I'm going to explain about the immunological mechanism of influenza vaccine. So, influenza viruses express hemagglutinin and neuroamidase on their outer membrane as antigens. Those antigens have a major role in the pathogenesis of influenza. The antigens bind to the receptor of respiratory epithelium cells and infect it. The virus is transmitted through aerosols originating from coughs, sneezes, hand-to-hand contact, or other personal contact from infected individuals. Vaccination is needed to suppress the spread of these viruses. Vaccination can induce immune effectors. Currently, there are three types of influenza vaccine that are used worldwide. The first one is inactivated influenza vaccine or IIV. The second one is recombinant HA vaccine. The third one is live attenuated influenza vaccine. The IVIV is worldwide the most widely used method.
My name is Putu Cahya Prameswari with the last three digits of my student's number are 151. I will continue to explain the immunological mechanism. First is humoral response. Infection that occur in the body will trigger the activation of B cells. If the signal is identified, the vaccine antigen can find its specific target to initiate immune protection. Antibodies produced by B cells use three mechanisms to find targets. The first is neutralization mechanism. This process will prevent the pathogens to enter their host cell through the antibody binding mechanism. Another mechanism involves pathogen binding to phagocyte. Then the last mechanism is the classical complement pathway. This process allows antibodies to attach to the pathogens and activate migration of immune cells to the infection site. Next is cell-mediated response. Antigen-presenting cell will present antigen identified by T cells. Naive T cells differentiate into CD4 and CD8 through the maturation process. CD4 will release cytokine to activate CD8 and send macrophage to the site of foreign particle. After the foreign particles get controlled, CD8 will undergo apoptosis and the memory cells will form. To date, the best mechanism to propose an influenza vaccine is to utilize CD4 effector. Another strategy is to optimize memory cells due to the high mutation rate of this virus.
Thank you for the opportunity. My name is Joanna Arisata Nuraharja with the last three digits of my student number 079. This time I'm going to explain about the indications to influenza vaccination in adults. According to Centers for Disease Control and Prevention or CDC, influenza vaccine is actually safe to be administered annually for all individuals older than 6 months of age and do not have contraindications. A full list of indications for influenza vaccination in adults are as follows. All adults are 50 years old or above, patients with severe or chronic diseases such as chronic pulmonary disease including asthma, cardiovascular, renal, hepatic, neurologic, hematologic diseases, and diabetes mellitus. Immunocompromised patients such as HIV infection or biomedications, pregnant people, residents of nursing home facilities, Alaskan Native individuals or American Indian ethnicities, and obese individuals. That is all from me. The next will be continued by my dear friend. Thank you.
Hello, my name is Natasha Pramatya Putri with Triola student number 111. I want to explain about the contraindication to influenza vaccine. Influenza vaccine should not be given to the person with this criteria, such as person with febrile illness. The vaccine can be given after the symptoms resolve. And then person with ache, gelatin, antibiotic, or other component anaphylactic hypersensitivity. And then persons with history of severe allergic reaction to influenza vaccine. And then infants younger than 6 months of age for egg-based IIV4 and CCIIV4. And then persons younger than 18 years old for RIV4, and then child under 2 years old, and person older than 50 years old for LAIV4.
Well, thank you for the opportunity. First of all, let me introduce myself. My name is Putri Balkis Hansa Alkanza with the last three-digit number 136. Right now, I'm going to explain about the administration of influenza vaccine. Every person aged 6 months and older who has no contraindications is advised to receive the influenza immunization. The CDC recommends receiving a flu shot by the end of October. Vaccination rates for influenza can peak as early as October and as late as April or May. Nevertheless, As long as influenza viruses are spreading, vaccination should be continued in order to ensure the optimum protection. Next is the procedure of influenza administration. The procedure of administration is determined on the type of influenza vaccination. For inactivated influenza vaccine or IIV and recombinant influenza vaccine or RIV, the vaccine should be injected via intramuscular. For adults and older children, it should be injected into the deltoid muscle, while for infants and younger children, it should be injected into the anterolateral thigh. Meanwhile, the vaccination administration for live attenuated influenza vaccine or LIIV must be injected via intranasal. All those vaccines can be given alongside other live or inactivated vaccines on the same day. Thank you.
My name is Manigede Fadarmawan with last three digits student registration number of 100. Adults over the age of 18 should take 0.5 milliliter of IIV4s each dose. Adults over the age of 65 should take 0.7 milliliter of Fluson high dosage quadrivalent or HDIIV4 each dose. For individuals over the age of 65, the quadrivalent recombinant influenza vaccine or RIV4, the quadrivalent high-dose inactivated influenza vaccine or HDIIV4, or quadrivalent adjuvanted inactivated influenza vaccine or AIIV4 are all indicated as preferential influenza vaccines. Older individuals or those over 65 years old are more likely than younger people to experience severe influenza related illness, hospitalization, and mortality.
Okay, let me introduce myself. My name is Audrey Esther with the last three digits of student number is 142. The effectiveness of influenza vaccines can vary from season to season due to the evolving nature of the influenza virus. It relies on the degree of match between the vaccine and circulating strains, with a good match resulting in high success rates in preventing infection. A meta-analysis found that the influenza vaccine is significantly protective against hospitalization in children, particularly for H1N1 and influenza B strains. In pregnant women, the vaccine reduces lab-confirmed cases in infants and hospitalizations, emphasizing the importance of healthcare providers promoting vaccination. Overall, vaccine effectiveness is influenced by factors like strain, compatibility, cost, and public perception, necessitating ongoing monitoring and public education to maximize vaccine impact.
Hello, my name is Tiputure Apsari with the last three digits of my student number are 058. I'll continue the presentation to talk about toxicity of influenza vaccine. The general adverse events that associated with the influenza vaccine, such as injection site reaction as the common effect after vaccination, also fever, irritability, drowsiness, and myalgia. It also can affect respiratory system, include upper respiratory and lower respiratory. Rarely, the vaccine can also cause allergic reaction and urticaria or anaphylaxis. That's all from me. Thank you.
My name is Joko Destipti Dewi with the last three digit number 189. Influenza is considered as communicable disease caused by an influenza virus that infects the upper respiratory tract. In order to maintain and prevent the spread of the influenza virus, people need to get influenza vaccine. The development of the influenza vaccine resulted in the most recent types of vaccine, inactivated influenza vaccine and live attenuated influenza vaccine. The immunological mechanism of this vaccine involves cellular effectors, which can prevent the virus from spreading inside the body, and humoral effectors, which can bind specifically to the virus antigen. The influenza vaccine is safe to be administered every year to everyone over the age of 6 months and has no contraindication. According to the Centers of Disease Control and Prevention, influenza vaccine administration depends on the type of influenza vaccine used. Inactivated influenza vaccine and recombinant influenza vaccine is given intramuscularly, while live attenuated influenza vaccine is given intranasally. Although the effectiveness of influenza vaccine can differ due to the ever-changing nature of the influenza virus, it is generally determined by a variety of factors, including vaccine compatibility with circulating strains, vaccine costs, and individual perception of the vaccine efficacy. Adverse effects linked to influenza vaccine, including common effect of vaccination, respiratory system disorder, allergic reaction, and increased risk of febrile seizures. Although things considered, public health officials must close monitor circulating influenza virus strains and update vaccine accordingly to maximize vaccine effectiveness, while also educating the public about the importance of influenza vaccine. Thank you. And that's all our presentation about influenza vaccine for adults from SGDB to you. We are sorry if there are any mistaken words or pronunciation. Thank you.